Hi everyone, my name is Dr. Graham Reynolds from the American Institute for Cognitive Therapy. Today we're going to be talking about substance abuse and treatment. So we have the DSM-5 diagnostic criteria for substance use disorders. If you're not familiar, the DSM-5 is basically the how-to for everything diagnosable. Any kind of psychiatric illnesses or disorders are listed in the DSM, and the criteria for substance use disorder are here as well. Now, between the 4th edition and the 5th edition of the DSM, there were some changes made. The 4th edition of the DSM had two different criteria dealing with alcohol dependence, other substance use, and it was divided into either alcohol or other substance abuse or alcohol and other substance dependence. The criteria were somewhat problematic in a few ways, in that, it tended to say, well, alcohol and substance dependence is more severe than alcohol abuse, or there were some interesting examples of cases where potentially somebody could be not meeting criteria for either, but may still be exhibiting some problematic drinking patterns. And so for the DSM-5, when it came out in 2013, the diagnosis was revised to sort of lump together the two previous diagnoses, abuse and dependence, into one diagnosis, which is now called substance use disorders. There are 10 different categories of substance use disorders. We're going to be talking about a few of the substances today. If you look at the criteria here, you essentially are getting a combination of the abuse and dependence criteria mashed together with the addition of craving. Craving is a new diagnostic criteria that was added in that did not feature in either the abuse or dependence definitions as it was by the DSM-4. So just a quick overview. You're looking at a problematic pattern of use leading to impairment as manifested by at least two of the following occurring within a year. These are things like taking substances in larger amounts and for longer than you might want to, wanting to cut down but not being able to do it, spending a lot of time getting drugs or alcohol, having cravings. As I said, that's the new criteria that was recently added in. Being unable to carry out major obligations at work, school, or home because of the substance use. Continued use despite pressure or problems that it's causing. Stopping or reducing important social, occupational, recreational activities. Going on here, we have recurrent use is hazardous or can be hazardous. These would be things like driving under the influence, would definitely fit for using in physically hazardous situations. Consistent use of substances despite acknowledgement of physical or psychological problems. Tolerance, which is defined by needing more of the drug to either achieve intoxication or using the same amount with a diminished effect. So it's sort of like if somebody starts out drinking 6 alcoholic drinks and finds that that causes them to be drunk, building up a tolerance, maybe then later on down the line they need 8 or 9 drinks to achieve the same effect. Or conversely, you could say that 6 drinks is no longer achieving the same effect of being drunk. Withdrawal is physical withdrawal. There's some diagnostic criteria around that, and for severe withdrawal, definitely want to be seeing a doctor. Things like alcohol abuse can be fatal, and even withdrawal from alcohol can be fatal. So if you or someone you know is struggling with these things, definitely speak with a professional. Now, for the diagnosis, in order to meet criteria, a minimum of 2 to 3 of these items is required for what's called mild substance use. If you have 4 or 5 of these symptoms, we would classify that as moderate substance use disorder, and 6 to 7 and above that is severe substance use disorder. So rather than having the 2 diagnostic categories, again, we sort of created more of a dimensional system. All right, jumping into discussion about alcohol. Using some data from the National Survey on Drug Use and Health, found that about 86.4% of people ages 18 and older have drank alcohol at some point in their lifetime. Now, this is not necessarily problematic drinking, it's just strictly taking the data on who has drank alcohol at some point or another. Looking at people that have drank in the past year, that's at about 70%, and looking at people that have drank in the past month, about 56%. So a little bit over half of people have drank alcohol in the past month. When we look at specific disorders. These are people who are using in that problematic way, meeting criteria for alcohol use disorder. About 15 million Americans, 18 and older, 16%, or rather 6.2% in this age group, had an alcohol use disorder. So that's quite a significant problem. This is affecting millions and millions of people every year, and oftentimes, as we'll talk about later, they're just not getting the treatment that they need, unfortunately. Now for some definitions. It's important to characterize, I would say it's fair to say that even independent of meeting criteria for an alcohol use disorder or substance use disorder, there are still ways that substance use, specifically in this case alcohol use, can be problematic even if somebody isn't necessarily meeting those criteria. So for some definitions, we look at what we would call moderate drinking, up to 1 drink per day for women and up to 2 drinks per day for men. That's already at a level that we would be considering moderate, where we look at binge drinking. The definitions for binge drinking is consuming 5 or more alcoholic drinks for men, 4 or more alcoholic drinks for women on the same occasion, meaning within the past couple hours-ish, for at least 1 day in the past 30 days. So an episode of binge drinking is 5 for men, 4 for women, in a short amount of time. And this is based off of the criteria of how much alcohol it takes to be meeting a 0.08 blood alcohol level. So the legal limit for driving under the influence, how many drinks does it take to get there? For men, it seems to be about 5 in the span of a few hours. For women, it seems to be about 4 in the span of a few hours. The third definition here of heavy drinking, this is essentially if somebody is binge drinking on 5 or more days within a month. So somebody who would meet criteria for heavy drinking is somebody binge drinking 5 or more days within a month. Some statistics on binge drinking. In 2015, 26.9%, so about 27% of people 18 or older reported that they engaged in binge drinking in the past month. So over a quarter of people have binge drank in the past month. And we're looking at about 7% that said that they were heavy alcohol users. Again, that's binge drinking on about 5 occasions in a month. When we look at college students and college populations in particular, this is an especially at-risk group. There's some pressure, social pressure to be drinking, things like this. It can be a big problem. 37.9% of college students aged 18 to 22 reported binge drinking, where about 33% of other persons the same age said the same. So it seems that there is an elevated risk of just being in college compared to same age peers who are not in college. Very important to be mindful about drinking and what that looks like in college, on college campuses. Again, 12.5% here. College students reported heavy alcohol use in the past month with about 8.5%. So we're seeing significantly more people in college with these problematic drinking patterns. Again, this is not even necessarily that they meet criteria for alcohol use disorder, but still could be engaging in some problematic drinking, and college seems to be putting people at a little bit of an elevated risk for that. So it's an important consideration if you or your child was going out to college, talking about drinking, being smart about drinking, thinking about these things, and discussing these issues. Now for New York State specifically, since we are located in New York State, some of the data that we have, this is alcohol use in New York based on survey data from the 2015-2016 National Survey. Estimated numbers in thousands. So when we see 9,002 here of past month alcohol use, that's 9,002 thousands, otherwise 9 million people roughly. So we've got about 9 million people who have used alcohol in the past month. Past month binge alcohol use. Again, in estimates of thousands, we're looking at 4.2 million people, give or take. And people meeting criteria for alcohol use disorder, again, strictly in New York, we've got about 1 million people who are actually meeting criteria in the DSM for alcohol use disorder. So this is a significant problem. It's perhaps one that maybe we're not talking about enough, which is why we're creating these videos here today. Now, shifting to other drugs of abuse. This chart is from the National Institute of Drug, and I don't really like how that went. Now, in talking about drugs of abuse, this graph here is showing past month use of selected illicit drugs. This chart was taken from National Institute of Drug Abuse. You have the different graphs, all illicit drugs at the top. Marijuana is the most commonly abused illegal drug, followed by prescription drugs that are being abused. So maybe this is drugs that are prescribed to other people or used in a way that's not directed. And then at the bottom we have cocaine and hallucinogen use. We see that there does seem to be an uptick in marijuana usage, and this may be related to changing attitudes about marijuana. Again, it's worth a conversation about the impact of marijuana, what that does for individuals, what that does for somebody on a personal level. It may be that even though these things are moving towards legalization, it still can be a problem for a lot of people. In the past year, about 4.2 million people aged 12 and up met criteria for a substance use disorder based on marijuana use. So in the past year, that many people are being diagnosed or meet criteria for the diagnosis of marijuana use disorder. New York State alone, we've got about 2.3 million people reported that they use marijuana in the past year, and 1.5 million people reported that they use marijuana in the past month. Interestingly enough, about 125,000 people began using marijuana in 2016. So those are new users. This is continuing to be an ongoing problem. When we look at legalization, we've got about 22 states and Washington, D.C. and Puerto Rico that have legal marijuana markets, and 8 states have gone as far as to legalize recreational use. So that, as I said, the trend is definitely towards more legalization. That's not necessarily to say that this is safe or a better alternative to alcohol. This is really a conversation worth having and looking at what is the impact that these drugs are having on you or family members or people that are important to you. This is a graph of the legalization, the different states. 30 states have medical marijuana legalized. 16 allow for the use of CBD, cannabidiol, which we'll talk about in a bit. 9 states have legalized recreational use. And now we'll call it a day for here, and we'll pick up next time talking about the health impact and impact of marijuana.